All right, this chapter in medical terminology, we're going to focus in on the cardiovascular system and the lymphatic system. Together, these are kind of clumped together as the circulatory because both of these systems have vessels that allow fluids to circulate throughout the body. So if we take a look here, the whole point of these systems, when we look at the cardiovascular system, is to move blood. Okay, so the cardiovascular system is going to use the heart with blood vessels to move blood throughout the body. Now, it is composed, when we look at the cardiovascular system, of the heart. These vessels are known as the arteries and veins. Arteries take blood away from the heart. Veins take blood back to the heart. And then we have the lymphatic system, which are structures that transport lymph. Now, lymph is just another name for like the interstitial fluid that's around your cells. It just gets this name because it's inside the lymphatic vessels. Ultimately, this fluid is going to be taken back to your cardiovascular system, back to your blood through the lymphatic vessels. Okay, so they're going to return the fluid back to your blood. So these two systems kind of work together. So let's talk about the cardiovascular system first. When we're talking about the cardiovascular system, it does transport substances. It does this through the blood. So the blood is going to end up delivering nutrients and other essential kind of materials that it needs to the cells. These include things like oxygen, the nutrients like glucose, amino acids, that kind of stuff. But another thing that this system needs to do as well is it needs to remove the waste from these cells. So we want to deliver the good stuff and we want to take the bad stuff away. These waste products are going to be things like carbon dioxide, because the cells are going to use the oxygen in cellular respiration. Carbon dioxide is going to be produced. Excessive water. We also see things like urea, ammonia, that kind of stuff. It needs to be taken away. So the removal of the waste products is going to be by the blood as well. So when we're talking about circulation, circulation is broken into kind of two main groups. We have what we call systemic circulation. Now, systemic circulation is going to leave the left side of the heart. It's going to take blood through the aorta first. So aorta is talking about the big vessel, the aorta, which is leaving the heart, carrying blood to the whole rest of the body. Now, this blood is oxygenated, meaning it does contain oxygen in it. It's going to then travel from the aorta to smaller arteries. These arteries get smaller and smaller until they're called arterioles. So arterioles are going to be the smallest little vessels of the arteries. Now they're going to then come in contact with the veins, where in this area it's going to be called the capillary bed. And I'm going to take a look at that a little closer in just a second. But then they're going to come in contact with those veins. The veins are going to take the blood back to the heart. At this point, they've dropped off the oxygen and they've picked up the carbon dioxide or the waste. These little veins are called venules. The venules will then go into veins, larger veins, and then eventually the big vein in here, which is called the vena cava. Now there's an inferior vena cava, which is below the heart. This is going to get the blood from below the heart back to the heart. And the superior vena cava is going to drain the blood from above the heart into the heart as well. So we have superior vena cava, inferior vena cava. Now, this dumps the blood back into the right side of the heart. Now it is deoxygenated, so it's shown as being blue. It does not have oxygen present. So this means that it has to go into a second circulation called the pulmonary circulation. The pulmonary circulation is going to be focusing more on getting oxygen into the blood. So we're going to see that these vessels are going to go towards the lungs. They're going to then pick up oxygen and go back to the left side of the heart. All right, and so that's where you see the pulmo, meaning lungs. Okay, so the pulmonary circulation is talking about that part heading to the lungs. Then the blood leaves the lungs and goes back to the left side of the heart, and then it enters systemic circulation again. So this is almost like a figure 8 that's happening, and it's going to allow for the blood to go to the lungs, pick up oxygen, deliver that to the body, come back to the lungs, and so on. All right, so it circulates through. So guys, this is what the capillary bed looks like. This is where the actual oxygen exchange is going to happen, where oxygen is dropped off to the cells, carbon dioxide is picked up. This is also going to be where nutrients are dropped off and waste products are picked up. So you can see that the artery or the arteriole comes in. There's exchange happening with these tissue cells. The blood goes from like a reddish color to a blue, but there's a transition as it drops off that oxygen. There's also going to be fluids found in this area. This interstitial fluid is the fluid in between all of the cells. We also call it the extracellular fluid because it's outside of the cells. And the lymphatic vessels shown in green are going to help collect any extra fluid that seeps out from the blood vessels or the cells themselves. This is to help prevent swelling in the tissue. So it's going to help pick it up and it's going to deliver it back to the cardiovascular system. Now you can see the pathway here. You can see arteries to the smaller ones, which are the arterioles, to the arterial capillaries. This is going to drop off stuff to the tissue cells. It's going to pick up the waste from the tissue cells and go into the venous capillaries, the venules, the veins, and then ultimately the vena cava. So a little anatomy review that we want to make sure that we take a look at here are some terms that deal with the heart. So the heart does have many layers kind of to it when we look at this. So we're going to look at some of the layers. We see that the outermost layer is known as the pericardium, peri plus cardio plus IUM. This consists of a series pericardium membrane. So this membrane is going to have two layers. The parietal layer is the outside layer. The visceral layer is actually touching the heart itself. And there's going to be a space in between. The space is going to contain pericardial fluid. Now the reason the heart is in a sac like this that has two layers with fluid in between is to help reduce friction. Because every time the heart beats, if it was rubbing against the tissues, you would see that heat would be created. So we have this fluid in there to help reduce that friction. Now, that visceral layer of the pericardium can also be known as the epicardium because it's the outermost layer of the heart itself. Now, this pericardium does have a fibrous layer. That's going to be the part that's going to help protect the heart. The adjective form of pericardium is pericardial. So you have pericardial being the adjective form. Now, the middle layer of the heart is made out of muscle. This means that the middle layer is known as the myocardium. Myo meaning muscle, cardio meaning the heart. The innermost layer is known as the endocardium because it's the innermost. Now, this endocardium layer is going to have a very kind of slick structure to it. This is, again, to reduce the friction as the blood moves through. And this same kind of tissue found in the endocardium is the same tissue that runs through the arteries, the inner layer of the arteries. Now, remember that arteries supply oxygen to the heart through an area called the coronary arteries. Coronary means like encircling or crown. So these are going to be the arteries that circle and go around the heart and give the heart the oxygen that it needs and the nutrients it needs in order to work. So you can see the layers here. You've got the coronary vessels, you've got the pericardial, which is the parietal, and you also have the visceral, known as the epicardium, the myocardium, and the endocardium. So a little more anatomy, let's talk a little bit about circulation and conduction. So this first picture over here is going to focus more on the circulation. It gives you a cross section of the heart. So they've cut through it. You can actually see inside of the heart and look at the different chambers. So starting with the vena cava, the blood goes into the vena cava. We're going to then trace it out of here. So it's going to go into the right atrium. Okay, so the right side of the heart and the right top part of the heart is called the right atrium. It's then going to travel through a valve called the tricuspid valve. This is known as the tricuspid because it has three flaps to it. This then leads into the right ventricle. The blood then is going to be pushed out of the right ventricle through another valve. This valve is going to be known as the pulmonary semilunar valve. This valve is going to lead to the lungs. So it goes then from that valve to the pulmonary arteries, the lungs, the pulmonary veins are going to bring it back to the heart. This is going to then enter into the left atria of the heart. It then will travel through a valve called the bicuspid valve, meaning it has two flaps to it. This valve sometimes is also called the mitral valve. This enters into the left ventricle. Now, if you'll notice, the left ventricle has a very, very thick muscle here. That is because this ventricle is responsible for pumping the blood to the whole rest of the body. So it's going to end up pumping the blood through the aortic semilunar valve into the aorta. Okay, so this is kind of the circulation of blood. Now, if you take Anatomy 2, you're going to spend a whole chapter talking about this and going through that circulation process. Now, the reason there are valves present, which you can see in this picture here, The tricuspid and the bicuspid valve are the separations between the atria and the ventricles within the heart itself. So it's separating those chambers. This is to help prevent the backflow of blood so that when the heart contracts, blood doesn't flow backwards. Just like in your house, you don't want your plumbing to flow back. Okay, you don't want to flush the toilet and it starts coming into the bathtub. That would be terrible, and we don't want the same thing to happen here with the blood. So it helps the blood move in one direction. Now, these valves that separate the atrium from the ventricles are known as the AV valves or the atrioventricular valves. Okay, so tricuspid, bicuspid valve are known as atrial ventricular valves or AV valves. Now, the pulmonary and the aortic valves, the semilunar valves, they look more like half moons. Okay, so when they close off, they kind of look like a half moon. These guys are going to prevent the backflow back into the heart after the blood has already left. All right, so again, pushing the blood in one direction. Okay, so that's what this picture is showing you, and it gives you the direction, shows you the deoxygenated blood coming into the right side of the heart, and then it also shows you the oxygenated blood going back into the heart from the lung. Now, the second main picture here is going to talk to you more about the cardiac conduction system. So how does the heart know when it needs to pump? Well, there are a set of cells throughout the heart tissue, especially that myocardium, that muscle area, that's going to then help it contract and help it contract where it's coordinated. All right, we don't want the heart to just do their own thing because then that's going to make the heart quiver, which then causes major issues. That's where we have to shock somebody with the defibrillator and start it over. We want the heart to pump in a sequence where the top part of the heart pumps first, then the lower part of the heart. And so we want it to do this. Now, in order to get it to do that, we have to have some conduction system in place. So you'll notice the first one is the sinoarterial node or the SA node. That is the pacemaker of the heart. It's the one that keeps the pace, helps us know what we need to do when we send out those contractions. This will then travel through the atria to the atrioventricular node. This node is in between the atria and the ventricles. At this point, the atria, the top two chambers, are depolarizing and they are going to contract, pushing the blood from the top part of the heart to the bottom part of the heart. The AV node slows down the signal just enough for that heart to dump the blood into the ventricles. So the atria can dump the blood into the ventricles. Once the blood's in the ventricles, the signal goes from the AV node down through the arterioventricular bundles. This is also known as the bundle of His. This separates into a left branch and a right branch, and it goes all the way down to the apex of the heart, the point of the heart, and it travels up these little fibers called Purkinje fibers. These fibers then allow this part, the ventricles, to contract from the bottom up because we've got to push the blood up and out of the heart. So gravity helped take it from the top of the heart to the lower chambers of the heart, but now we've got to pump it up and out of the heart. So we've got these stronger muscles that are present, and the Purkinje fibers are going to help coordinate this. Okay, so we pump it from the bottom up, okay, sending the blood up and out. So some other terms that come into play when we're talking about the heart itself is going to be heart rate and blood pressure. So when we look at your heart rate, we measure this in beats per minute. So BPM is beats per minute. And we do this by taking your pulse. Now, the pulse is the rhythmic expansion of an artery. Okay, we do the artery because of the higher pressure. You can actually feel it moving, and you can feel it through the surface of the skin. Now, we can do this in multiple areas. So you can find your pulse here with your carotid. We also, a lot of times, will take our pulse here, which is with the radial. So we have the radial artery. We can also take the pulse in other areas as well, like maybe even the brachial. We also can use the femoral on the leg. They can do pedal on the foot. So there's different areas that we can end up taking the pulse, and it's this rhythmic expansion of the arteries. Now, a normal pulse rate is going to be anywhere between 60 to 100 beats per minute. Now, this depends on the person, and it also depends on the shape and the age and a lot of factors that the person that we are looking at for their heart rate. However, if the heart rate is below, okay, so if it's below 60 beats per minute, we would say that this individual has bradycardia. And remember, brady means slow. Cardia is telling you the heart rate. So bradycardia is slow heart rate. On the other hand, if it's above 100 beats per minute, we say that it's tachycardia. So this is going to be a fast heart rate. Now, another thing that we need to look at is with blood pressure. With blood pressure, we are going to take it and you're going to get two numbers. Okay, so we have two numbers. The top number, which is the higher number, is known as your systolic pressure. Now, the systolic pressure is the pressure when the ventricles are contracting. So when those big muscles are contracting and pushing the blood up and out, you're going to have this larger number. It has a higher pressure. Okay. On the other hand, the diastolic pressure is going to be when the ventricles are relaxed. Now, this number will never be zero because there's still pressure from the blood traveling through the blood vessel, but it is going to be the lower number. Okay, so you have the systolic, which is the higher, you have the diastolic, which is the lower. Now, a sphygmomanometer is what's used in order to be able to measure the blood pressures. All right, so the blood pressure cuff is what we would use there, and this is going to give you the systolic and the diastolic pressures. So when we're talking about the heart, there's also some lab tests and diagnostic tests that can be utilized for the cardiovascular system. One is we want to look at lipids. Lipid levels are things like cholesterol and triglycerides, and they do travel through your blood. High levels of these two lipids are associated with a greater hardening of the arteries, like a plugging up of the arteries, like arteriosclerosis, to where there is kind of a narrowing of the blood vessels, and that can create some major problems with us. We also see that there are lipoproteins. These are known as low density or LDL proteins or LDL lipids, as well as high density, which are HDL. When we look at these two guys, lipids need help traveling through the blood because they don't like water. And so they have special proteins that help with this. An increased LDL, so the increased low density lipids, is associated with increased risk of cardiovascular disease. This is a lot of times known as your bad cholesterol when you get blood work done. On the other hand, if you have an increased HDL, the high density, it's associated with a decreased risk. So that is going to be your good cholesterol. So in most cases, we want to see that the bad cholesterol is low and the good cholesterol is higher. That means things are working like they should. Okay, and so these are those particular lipoproteins that travel through the blood. We also see there are enzymes that play a role, and they can be found in blood tests or blood work as well. Lactate dehydrogenase, creatine kinase, as well as creatine phosphokinase. Those are all going to be enzymes that are found in the blood after heart attacks. Okay, so these enzyme levels raise in the blood after heart attack happens, and this is because the cells of the damaged heart cells release this into the blood. Okay, and so these enzymes, when they say, oh, we need to get cardiac enzyme panel, these are the ones they're talking about. All right, so they're collecting that in order to see if a heart attack has occurred. Now, if we go to the radiology stuff, when we talk about diagnostic tests, some of them are going to be non-invasive. This means we're using those radiologic tools to be able to get pictures without actually cutting into the body. So they can do cardiac MRIs when we look at this. These can also be an electrocardiogram. We call those an EKG or an ECG. Okay, so where they set it up and they're looking at the electrical signals of your heart. They could also do a PET scan, okay, to check your heart out as well. But if we're going to look at some that are more invasive, these tests are going to be done in order to help also correct some potential issues. These are going to be things like a coronary angiography. This is where they're going to go in and do what they would consider the procedure of an angiogram. And so they'll send in a catheter up through normally they go through like the femoral vein and they go up into the heart, and they're checking out those coronary vessels in order to see if there's any blockages present. We also see that we can do an arteriography. An arteriograph is used the same as photograph. It's to give like a picture of the arteries in order to get an idea if there's any blockages or anything like that. All right, and so these are some of the diagnostic tests specifically used for the cardiovascular system. So let's talk a little bit about heart pathology. There's some terms that are going to come into play throughout the chapter here. We see that rhythmo is going to talk about rhythm. You'll see D added to the front of a lot of words, which means down from or reversing the issue. Sclero or sclerosis, those are going to be hardening or hard parts to the vessels. And then stenosis is a narrowing that takes place. And so let's talk a little bit about some of these. So congenital heart defects are defects that a person is born with. So congenital means they have it at birth. Now, some examples of these are going to be what we call septal defects. Now, your atria are separated into a right and the left by a septum, as well as your ventricles are separated by a septum for the right and the left. Kind of think about like your septum in your nose, which separates your right nostril from your left. Okay, so this is going to separate in the heart, goes down the center. Now, when we talk about congenital heart defects with a septal defect, this is because there's going to be a hole a lot of times in this septum. It's not completely cut, like completely closed off. And so when you hear about babies that were born with holes in their hearts, this is probably what's happening, is these septums haven't closed off completely. Now, this can create an issue because it can cause a mixing of oxygenated and deoxygenated blood for the child. Another one are going to be heart murmurs. Murmurs are abnormal heart sounds where the heart doesn't sound correctly. This is normally going to be due to the actual valves not closing like they're supposed to. It can cause a kind of whooshing or backflow of some of the blood. And so a lot of times it's a valve issue, but it can be any kind of number of issues with the heart itself. We also have patent ductus arterius. This is known as the PDA. This is where there's actually an opening between the pulmonary artery and the aorta. So in a baby, when they're in the womb, their lungs are kind of pointless, all right? They practice breathing and they practice sending the blood to the lungs, but they don't actually pick up oxygen there because they're in fluid inside the mother. The oxygen exchange is going to happen at the placenta with the umbilical cord. So there's a little like bridge in between the pulmonary artery and the aorta so that blood can travel through that bridge because it doesn't have to go to the lungs. However, after the child is born, that bridge needs to close because they do have to use their lungs now, and we don't want the blood going from the pulmonary circulation, bypassing the lungs and going back into the aorta. So this should close off. If it doesn't, you have a PDA. We also have the coarctation of the aorta. This is going to be where the aorta is supposed to come and go up and then curve and come back down. And so when we're talking about this particular issue, this is where that is narrowed, causing the aorta to have a harder time getting that blood around that curve. Right? It's a narrowing of that vessel, the aorta. Then we have the tetralogy of Fallot. This is actually where there's 4 heart defects that have been named after the French physician who kind of put them together. And so he's the one that kind of got to name it after him. And so tetra means there's 4 and Fallot is his name. Another thing we see here are the arrhythmias. Arrhythmias are going to be anytime there is a issue in the rhythm of the heart. It doesn't necessarily mean there's no rhythm, because a lot of times if you add a in front of a word, it means not. It just means that this is a disruption. So a better term actually could be used as a dysrhythmia, where there's a difficulty or issue with the rhythmia. So dysrhythmia is actually probably a better term, but it is a type of arrhythmia. Now, these different types are going to be things like heart flutters. Heart flutters are rapid contractions of either the atria or the ventricles. This can cause your heart to have what we call palpitations that take place. These could be due to your like heart racing. It could be where you feel like it skips a beat. This can happen due to just normal stress or emotional type of responses. We also see that you can have ventricular fibrillation. This is a severe cardiac arrhythmia in which the ventricles are not waiting their turn. They are going to be contracting too rapidly. So the heart should be doing this number, okay? But with ventricular contractions, where we see that they're doing fibrillation, they're kind of shaking like this, and they're not completely pumping, and they're not letting the blood come from up here first. And so this creates a disorganization in the electrical activity. Atrial fibrillation, this is where the atria are kind of quivering. They're not doing their job. And this one is not as dangerous, but we still have to take care of it. We then have the atrioventricular block, or AV block, or AVB. This is where the impulse transmission from the atria to the ventricles is impaired somehow. This is normally an issue where it's not sending the signal, so this causes an arrhythmia to occur, and it causes the heart, part of the heart, to be blocked from its contraction. Another thing we can see is going to be ischemia. Ischemia is insufficient blood flow to an area. It can cause if we're talking about the heart, it can cause chest pain. This is also known as angina pectoris, or angina just for short. This is going to be where we're not getting enough oxygen and blood flow to the heart itself. If this continues, it could cause a myocardial infarction, an MI, which is a heart attack, to occur. When we look at the heart attack, that means that there's prolonged ischemia to the muscle of the heart, causing it to have necrotic tissue start to happen. The cells actually start to die. We then have congestive heart failure. This is an impaired cardiac function where the fluid accumulates in the interstitial places around the heart. This accumulation of fluid can be in the pericardial space. It can lead to compression of the heart, and it can also, when it does that, cause what we call cardiac tamponade, where it actually starts to compress and squish the heart itself. There's some valve issues that can come into play when we're looking at the heart in the structure. Valvular stenosis is the narrowing or opening of a valve. This can cause decreased blood circulation. Valvitis is the inflammation of the valve. So the valve is inflamed somehow, maybe due to an infection. We have mitral valve prolapse, or MVP. This is going to be where the actual valve starts to sag. Prolapse means like a sagging to take place. Sometimes somebody who has MVP doesn't have very many symptoms at all, and other times they can be very severe. You hear it a lot of times as in a heart murmur when somebody has MVP, or mitral valve prolapse. Another one is rheumatic fever. Rheumatic fever may develop as a delayed reaction where they do not take care of an upper respiratory infection in time. A lot of times this is due to like strep not being taken care of as quickly as it should, and a complication means that bacteria can travel to other areas in the body, including the brain. It can also cause joint issues. It can cause issues in your skin, but it can also cause problems in your heart. If it collects on the heart valves, it can actually cause valve damage, specifically to the mitral valve normally, and it can cause heart problems due to rheumatic fever. And this causes what we call rheumatic heart disease. All right, some terms that are important when we talk about blood vessels. So blood vessels are going to be things, when we look at terms, are going to be things like aneurysm. An aneurysm is a localized dilation or ballooning of the vessel. So if the vessel is supposed to look like this, it can cause a ballooning to come out where fluid collects in there and weakens the vessel until it could rupture. We also see arthro means like a yellow color. A fat plaque is part of this. So arthrosclerosis is going to be a type of arterial sclerosis. Arterial sclerosis means a narrowing of the blood vessel that takes place, but this would be due to, of course, a fat deposit. This could cause a blockage to occur. We also see that we can end up having issues because of blood clots. A blood clot in a vessel, especially in the brain, can cause a cerebrovascular accident known as a CVA. It can also cause an embolus to be, it could also cause a thrombus to be thrown. It can also cause a cerebrovascular hemorrhage where there's bleeding that takes place. All of this is going to ultimately lead to ischemia of the brain tissue, and it could cause the brain to die. And this is also known as a stroke. We can have coronary artery disease, or CAD. Coronary artery disease causes a reduced flow of oxygen and nutrients to the muscle of the heart, the myocardium. This could also result in a heart attack or a myocardial infarction. Another one here is the peripheral vascular disease, or PVD. This is a blockage or narrowing of the arteries that results in inadequate blood flow to your extremities. So it causes issues of getting blood to your extremities. Arthrosclerosis is normally a culprit of this, where there's a buildup of that fat within these vessels. Now, this isn't all of the vessel pathologies, but this is just to give you a few. Some surgical and therapeutic interventions that come into play when we're talking about the heart and the vessels. We do see that you can have a cardiac pacemaker put in. If that SA node that's supposed to be keeping pace for your heart, making sure you're beating like you should, if those cells get damaged due to like a heart attack or something like that, we may have to put in an artificial pacemaker in order to help keep pace for the heart. And that's what a cardiac pacemaker would do. We also have coronary artery bypass graft, or a CABG, CABG. This is going to be if there are blood vessels that are blocked, especially if they're like 100% blocked. we can't necessarily go in and just clean out the blood vessel, and so they create a bypass. So if the vessel's here, they bypass the blockage. They create another vessel that goes around it, bypassing the damage in order to restore blood flow to the other side. Okay, and sometimes they can also do this by putting in a shunt, opening up the blood vessel if it's not completely blocked. Now, a PCI, or a percutaneous coronary intervention, it is pretty invasive, but it's a non-surgical type of management. It's involved in the use of catheters that are going to be inserted in the occluded or stenosis arteries, and it tries to compress the plaque and destroy it. Now, this can be done through like lasers. They could implant stents this way. So there's a lot of different ways that they could use that. An endarterectomy is going to be a surgical excision of the arteriosclerotic plaque. So when they have this buildup, they're going to go in and actually excise and cut out that plaque or the wall of the artery. It's commonly performed a lot of times in the carotid arteries here, where they'll actually clean out these arteries in order to restore the blood flow. All right, so that kind of completes more of the cardiovascular side, where we're talking about the heart, the blood vessels, that sort of thing. So we're going to switch gears a little bit here and talk about the lymphatic system that's talked about here. Now, with the lymphatic system, remember that it is going to help protect and maintain internal fluids. This is going to help be able to take those fluids, filter them. It's going to move them through the body back to the cardiovascular system. It absorbs and also transports fats from your digestive system. This is going to then be put into the blood also. And it serves as an important part of your immune system, because these lymph nodes that are located strategically in all the different areas of your body are going to contain B cells and T cells, which are part of your immune system. So your immune system works with your lymphatic system as well. So some terms that are important here are going to be like adeno, that's going to be gland. Lympho is lymph or lymphatics. Lymph adeno is going to be a lymph node, because you had a gland and you had the lymph. We also have lymphangio, which is going to be the lymph vessels. We have adenoid, which is going to be the adenoids, which are a specialized tonsil that's in the top of your mouth by your nose. Spleen is, which is going to be the actual spleen of the organ. Thymo, which is the thymus, and tonsil, which is the tonsils. So when we look at this, there are some special terms here. Now, so if we look at this picture, guys, you're going to see that we have some lymphatic ducts. We have some drainage areas. These are going to be where it pumps back into the subclavian veins and going back to the heart itself, dumping into the superior vena cava. We also see that there are lymph nodes. You can see them spread out through random areas. They're going to be in areas of connection. So you have a lot of lymph nodes here, okay, where your head connects to the rest of your body. This is the ones they palpate and look at when you go to the doctor and you have like a sore throat. We also see you'll have some in the axillary region with the armpits. You have them in your groin area. Okay. We also see that they're located along your digestive system, and anywhere invaders could potentially get in. Okay, you're going to find them there. Okay. Now, a lot of times when we talk about the lymph nodes, get named based on their location. So some diagnostic tests and procedures that come into play when we're talking about the lymphatic system are going to be things like lymphography and lymphogram. The lymphatic channels and lymph nodes can be x-rayed, and they do this after an injection with a lot of times a radioactive plaque material into the lymph vessels, and this is what gives them a better picture. So the radiography is the actual procedure, and the radiogram is the picture they get. We can also do a lymph angiography. Okay, when we do a lymph angiography, we are looking at the lymph vessels specifically. If we do a lymph adenography, we're looking more at the lymph nodes. Technically, you would probably do these more together. Now, biopsies of the lymph nodes are a big diagnostic tool for cancer. So when we're talking about cancer cells and we want to see if they've spread to other parts of the body, the lymph and the lymph nodes are a good highway for them. So we want to check these to see if they've accessed this highway, because we want to stop it if we can. Another one are blood tests. We can also, because your immune system is part of this, you can test with blood your B cells and T cells to give more information about the immune system. So some pathologies and surgical interventions that come into play for the lymphatic system. You have what we call lymphadenitis. This is going to be where lymph nodes are inflamed. Okay, so the itis, remember, is inflammation. Lymphoma is a type of neoplasm or cancer of the lymphatic tissue. This is going to be, a lot of times there's two forms, Hodgkin's lymphoma versus non-Hodgkin's lymphoma, and there's a difference based on how they clinically present and the histology, like what the cells look like in the two types of cancer that separates those two types of cancer. We also have a splenomegaly. This is going to be where the spleen becomes enlarged. Okay, it starts to swell. This can happen with certain kinds of infections. Thyoma is going to be a tumor or a growth in the thymus gland. Tonsillitis is inflammation of your tonsils. Now, again, these are not all of them, but this is just to give you an idea. So some examples of some interventions is we could end up cutting out some of this stuff. So when we talk about a lymphadenectomy, this is going to be where they take the lymph nodes out. This happens a lot of times when women have their breasts removed in a mastectomy due to breast cancer. They'll also take the lymph nodes in the axillary region out as well. And so that would be part of this process. So a splenoplexy or a splenography, those are going to deal a lot of times if they've been abdominal traumas. And we see that the spleen is actually rupturing because the spleen is a reservoir of blood and you can bleed out very quickly if the spleen is bleeding and we need to get it removed. So the spleen is one of those things you can live without and we may need to take it out. Thymectomy is where we would cut out the thymus gland, or at least part of it. Okay, excise it, take it out. And so again, these are just some examples. And the last thing we want to look at again are the pharmaceuticals and your abbreviations. Again, this is not all of them, but just some examples. You have your anti-anginal drugs. These are going to be to fight against angina. So these are going to relax the blood vessels to restore hopefully blood flow. We also have antiarrhythmics. These are going to regulate the cardiac rhythm of the heart and hopefully be able to treat a lot of those arrhythmias we talked about. Anti-hyperlipidemics, and so anti is against, hyper is high. A lipid is going to be the fats, and so this one's going to help reduce hopefully cholesterol and other types of lipids found in the blood vessels. Hemostatics are going to be types of medications that help stop bleeding, and thrombolytics are going to help dissolve blood clots. This is to help get rid of potentially embolisms from occurring, thrombosis. It would help prevent hopefully strokes. These are known as the clot busters. They're going to break up blood clots. Some examples of some abbreviations: you have aortic insufficiency, AI. You have ASD, which is atrial septal defect. AVB is atrial ventricular block. HTN is hypertension, so high blood pressure. LDL is the low density lipoprotein. PCI is the percutaneous coronary intervention. TEE is the transesophageal echocardiogram. So transesophageal means we're going across the esophagus, doing the echo picture of the heart. Okay, and so this is breaking those down, and you have some abbreviations. Again, this is not all of them. There are more located in your textbook, but this just gives you an idea. Okay, and so this kind of just gives you again an intro into chapter 4, which is looking at that cardiovascular and lymphatic system known as the circulatory systems together. So again, if you have any questions, please let me know.